Hello, everyone, and welcome to today's episode of the Black Scientist Cooperative. Today's episode is entitled Long Hair Don't Care. We're going to talk about the ins and the outs of the science behind hair and scalp. We have a very special guest today, Dr. Stevani Patterson. Get that, Patterson? My very, very special sister-in-law. And we are so happy to have her on. She is a dermatologist, and she's going to be talking to us today about how to take care of our hair and scalp. So let's kick it off by asking her a few questions. Stevani, can you tell us a little bit about yourself and why you decided to become a dermatologist?
Sure. So I am really happy to be here, first of all. Thank you all for having me. And I hope we have a really fun conversation about scalp and hair. It's one of the things that is really special to me. I enjoy taking care of people who are dealing with hair and scalp issues. So thanks for having me. So I did not always want to be a doctor and definitely not a dermatologist. When I was growing up, I didn't even know what a dermatologist was. I think it was really in medical school when I became aware of the field of dermatology. And the reason that I wanted to go into medicine is because I had so many family members who dealt with different illnesses. And I realized just how important it is to have a doctor that cared and that was compassionate and that really could motivate people to want to take care of themselves. And I saw that through one really special doctor that my mother had, and since then have been interested in medicine. So kind of a roundabout pathway for me. I didn't have any family members who were in medicine, so it was a new road, but it was a great one. And I ended up in the field of dermatology after spending some time in dermatology clinics while I was doing my internal medicine residency. So I started off doing internal medicine. I thought I wanted to be a primary care doctor. And while I was doing that, I spent time in dermatology clinics and just loved it. There's so many different things you can do. We do a lot of procedures. So I do surgeries, I do things like hair loss, and then your regular acne, rashes, and probably the other things that people think about when they think of a dermatologist.
And that's a great segue into my next question, Stevani. Can you elaborate a little bit on what a medical dermatologist does, and what are some of the most common skin and hair conditions you observe in your practice?
Oh, for sure. So I am a general dermatologist. I primarily focus on medical dermatology. And medical dermatology is, it's about skin, hair, nail diseases and the treatment of those, as opposed to more of the cosmetic side of dermatology. As you know now, there are a lot of different cosmetic treatments that are available to people for everything from wrinkles to you name it. And I focus more on your medical conditions or things that may influence other parts of the body as well. So for example, I may see a patient who has lupus and who is dealing with the signs of lupus on their skin. I think the most common things that I see would probably be skin cancers. So dealing with skin cancers and cutting out skin cancers or removing skin cancers, acne, rashes like psoriasis or eczema, a lot of hair loss, as well as, but those are really the kind of the main things that I deal with. As a medical dermatologist, I really have an interest in diseases that affect not only the skin, but the body, or that may be skin diseases that are a sign of things that are going on inside of the body. And I think the best example I can think of right now would be lupus.
So this might be maybe not a disease, but one of the things that happens to most of us as we age is that our hair starts to go gray. So why does that happen? And even some people, like my granddad, actually, he turned gray in his 20s. And so I think that it's, so clearly it may not always be associated with age, but why do we generally gray as we age?
Yes, so really good question. And graying is a normal process. The timing of it depends on your genetics. So for most people, it's around 40 when you start to gray. And it's considered early graying. If you're a Black person who grays before 30, that's considered early graying. But it's all determined genetically. There's really nothing we can do about it. What happens is that the production of melanin in our hair follicles starts to decrease. And so there's a pathway where there's an enzyme called tyrosinase that forms melanin, and that particular enzyme decreases the amount of it as we age. So it's a natural process, and we just have to accept it, whether we like it or not.
Yes,
I've embraced it. I have embraced it.
It's
Oh, well, it is what it is.
I have not embraced it. I have gone platinum, and no one will ever know when I gray.
So I'm gonna ask a couple of questions, more so related to hair loss. So why do so many people lose their hair as they age?
That's a really complicated question, and I'm going to do my best to break it down. So one of the more common forms of hair loss is called androgenetic alopecia, okay? And actually, before I even go there, let me just say that alopecia is a really broad term, and we hear it a lot. And I think a lot of times people consider any time that they're losing hair alopecia, but there are a bunch of different types of alopecia. And so the most common one, the one that people probably think about most, is androgenetic alopecia. That's the kind that we see when men bald. So when they start to lose it all up here, that's called male pattern hair loss, and it's a form of androgenetic alopecia. That too has a genetic component to it, and there's not much we can do to prevent that from happening. What happens is that the hairs start to miniaturize or get thinner and thinner. And in men, it happens right here usually, or everywhere. And then for women, fortunately, we don't lose it like them, but we start to thin pretty much over the entire scalp. So for most women, by the time they turn around age 50, they'll start to experience some hair thinning that's related to androgenetic alopecia, okay? Go ahead.
I'm sorry, go ahead.
Now, there are a whole bunch of other types of hair loss that we can talk about too. And those we can see over any time of the life course, but there are a couple that we see usually in the 30s and 40s. And we can talk a little bit more about some of those if you'd like.
So are there warning signs that kind of start to let us know that, it's time, it's leaving, embrace it? It's normal.
So, that's one of my big things that I want to communicate with people, is that not all forms of hair loss are normal, and we shouldn't embrace all of them, okay? Now, androgenetic alopecia, when you start to thin, for many people, that's going to be just this normal process. But until you know what's driving your hair loss or what's causing it or what type of hair loss it is, you don't want to just embrace it and accept it. You want to get it checked out and do something about it, so that if there's something that you can prevent or that you can treat, that you're able to do that. So
I'm sorry, Stefani, I'm struggling a little bit because we're talking about hair loss being natural, and I'm not ready to go into a lace front. But, my hair is thinning. And so what advice do you offer to those who are losing their hair? It's an alternative, can hair implants, or what can one do? Is a wig really the only option out there?
It's not the only option. So the first thing I would say is that if you begin to lose your hair, you really should go to a dermatologist and you should get it evaluated. And you can't just go to anyone, right? Your primary care doctor, they don't know a whole lot about hair. There are many dermatologists who don't know a whole lot about hair. So you really have to seek out someone who has an interest in hair loss and go and see them. And they need to do a full evaluation. They need to know more about your past medical problems, what you're experiencing right now, and do a full exam of your scalp. And in some cases, we even do what we call a scalp biopsy, where we take a little small piece of your scalp and we look under the microscope so that we can determine what's causing your hair loss. So don't just accept it. Start by going and seeing someone and trying to figure out exactly what type of hair loss you have and then what you can do about it. There are two types of hair loss that particularly affect Black women that I wanted to make sure we talked about. One is traction alopecia, and it can happen to anyone, but I see it a lot in Black women because of the hairstyles that we wear. So traction alopecia is loss of your hair due to trauma. It's just tension on your scalp in a lot of ways. You could think of it as actually, you know, we are yanking out our hair.
We're trying to get them edges right.
We're trying to get them edges right. And so, but we do a lot of damage. So be really careful with your hairstyles and making sure that you are not causing any damage to your hair by the styles. Nothing should be too tight. You should not have a headache at the end of getting your hair done or the next day. You know, I always tell my patients, your hairstyles should never hurt, right? They should never hurt. So you have to talk to your stylist. That's too tight. Please, you know, loosen that up a little bit. Don't grab every little hair. I don't need every little hair in there, because you can do permanent damage to your scalp that way.
This is mind blowing. Because you know, as we go, have
got my edges out.
I mean, I have locks, but I've, you know, even with wreath twists and things that, you know, I wanted to make sure that my, you know, hair was really. It's just like, it's almost like a rite of passage that you leave the shop with your hair tight, because, you know, just, I mean, I've known women to even take like aspirin or, you know, Tylenol before they go, just to try to get ahead of the headache or the soreness that's going to happen days after from their sewing. So it's just,
Well,
you
I
know.
used to be excited because it was like an instant facelift.
Yeah.
Like I knew after I got out that chair, my face was going to be tight because my hair was just that tight. My face, my eyes, everything.
Yeah.
Was put back.
I think we've all been there, right? I surely remember when growing up and getting my hair done and getting braids. And then, I mean, like your eyes are tight, got little hair bumps around here and you have a headache, and it's just not right. So we have to train our little girls to think differently about their hair and what looks nice. And I always tell people it can be neat, but it doesn't have to be tight, you know? So with your baby girls, you know, make sure that you teach them early that this is not the way it's supposed to be. This is a myth. It does not have to be like this. And think about, you know, even their little ponytails, that you're just not putting those rubber bands in there as tight as we think we need to, right? To make their hair look nice.
And teach them they don't have to keep a style for 6 to 8 weeks, that they need to like take it down.
That's good. Yep.
Absolutely.
Like, what would you suggest? How long is too long to have braids or sew-in or whatever?
So I don't know if there's a specific answer, because with each style, you know, you probably have a little bit of flexibility, right? But one thing that's really important is that while you're wearing those styles, you still need to take care of your hair. So if you ask most dermatologists who specialize in Black hair, they'll tell you every 1 to 2 weeks you should be washing your hair, no matter what style it's in. A lot of times we put it into different styles and then it's months, right? Long time, or maybe not until we take it down again. But that really, for a healthy scalp, you need to cleanse your scalp at least every 2 weeks.
I don't mean to belabor this, but I just want to get all the myths out there, because when I used to get my braids, they would say, don't wash your hair, just get some sea breeze antiseptic and put half sea breeze, I'm serious, and half water, and spray that on your scalp to stop the itching and to keep it clean, but don't wash it. So you're saying no?
No, you have to wash your hair. And even with the dry shampoos, you can use a dry shampoo, but you still need to put some water on your scalp and cleanse it.
I'm
Okay.
just, listen, I think if I was to get in a routine, and I'm just going to put my own self out there, I've had my life for about 22 years this year. And I think if I start to get on that regimen of 2 to 3 weeks of washing my hair, all of my hair would fall out. It would be it would go into instant shock because I do not wash my hair that often. And I think part of it was because when I first started, that was one of the things, like, you don't have to wash your hair that often. So, this is eye-opening for me. And, when you know better, you do better.
We're all learning, right? I think a lot of times too, we try to preserve our style because you've gone to the shop, you've spent all this money to get it done. Nobody wants to wash it away. You're trying to keep it as long as you can. And so we've gotten into this habit of not shampooing our hair regularly, but it's hard. I struggle with it too, but it really is the best thing for our scalp and our hair.
So to piggyback off of that though, with washing every 1 to 2 weeks, if it's prescribed by Dr. Stevani, what does it look like when we're talking about greasing our scalp regularly or putting the moisture back into our scalp? So how does that play into healthy hair? And should that be a regular practice? Or can we just put us some, blue magic on, on there and call it a day?
That's such a good question. And there are a few different points to make. So our hair, Black hair, is dry. Okay. We don't have so we make natural oils in our hair, but not in the same amount that other races do. Okay. People with straighter hair, I should say. People who have curlier hair, the curlier the hair, the drier the hair. And so we definitely need to add moisture back. We mainly need to add moisture back to our hair, not necessarily the scalp, but we need to add it to our hair so that there's not breakage. Because if you have dry hair, then your hair will break, okay? So definitely you need to be adding moisture back. However, a lot of times we're putting blue magic on our scalp because we're trying to conceal the dandruff that's there or the itching or the flakiness that's there. And we do not want to do. It's not, the blue magic is not going to heal that. And so we need to take care of our scalp. If you have itching and flaking and all of that, it's not normal. And that's another thing that I feel like a lot of Black women feel like that's just part of the routine, that's normal, and it's not. So if you're dealing with that issue, or if you have that issue, you need to deal with that first, and then you need to be adding moisture back to your hair on top of that. And another important part of the moisture, so not just oils or grease or whatever it is you like to put in your hair, but also the shampoo and conditioners that we use are really important. And so you want to make sure that you're using really good moisturizing products in your hair, shampoos and conditioners.
I think we're going to have to pause for a second and just give Blue Magic a few seconds of silence.
And how about Dark and Lovely? Throw that in there too.
This is a huge
This
hit
is huge
to the Black community. Just a moment of silence for Blue Magic. Okay. I'm getting this in my spirit, and the viewers need to get it in their spirit too, because we just lost.
Blue magic is not going anywhere.
So I do want to piggyback off of something else you just mentioned. So we talked about how curlier hair types are drier. And so I kind of want to segue that into the types of curl patterns and the types of curl patterns that we see and how they're classified, and whether or not that curl pattern type should dictate the type or of management we do to our hair and the types of oils, moisturizers, shampoos, conditioners. How does that play into how we should be taking care of our hair? Because between us, 5 of us on the call, we probably have, a good 5 to 10 hair types on all of our different scalps, because you don't necessarily have just one type on your head, depending on, your genetics. but how does that play into how we're supposed to take care of our hair?
So one of the main ways is what we kind of mentioned before, is that curlier hair type. So like I'm a 4C, and my 4C hair is extremely dry. And the amount of moisture that it takes for me to keep it under control is a lot. So that's one of the main ways. I think the other thing is just how we manage it, you know, because people who have wavier curl patterns or not as tight curl patterns, they don't always necessarily have the same hairstyles or things. They're not doing the same things to their hair that people with a 4C are. Not to say that you can't, but in many cases that you are not. And so I think that is another big difference. The other thing is the amount of shampooing and conditioning, because if you go back to talking about that sebum, the natural oils, when your hair is straighter or you have wavier patterns, then the sebum that your scalp is producing when you comb or brush is going throughout the entire length of the hair. Whereas when you have curlier patterns, that oil, the natural oil, kind of gets stuck on those curls so that it's not going through the entire length of the hair, right? And so the amount that you need to shampoo and condition may be different, and the amount of oil that you need to add back is different.
I just say moisture. We need to add moisture to our hair. Is that in addition to like washing the hair 1 to 2 weeks? If so, like what kind of products add moisture in, if not like the greases and things? Like what type of product do you look for?
I don't have anything against grease or oils. It's really, and that's the other thing, our hair types are so different. And like you said, even different parts of our hair, our scalp have different curl types and textures. And so every texture really may need a different product. And I usually reserve that I leave that to the stylist. I know I'm no hairstylist. Okay. And you probably should work with your stylist to help you figure out what is the best product for your hair. Or you can do like I do sometimes and just buy all kinds of stuff. And I got everything underneath my cabinet trying to figure out which one is going to work the best, right? Yeah, so so if you like coconut oil is fine. If you like Blue Magic is fine. There are many dermatologists who suggest using products that coat the hair. And a lot of those are products that contain dimethicones because they kind of coat the hair. And so you can look for those. A lot of the newer natural hair products carry them. The other thing would be your shampoos and conditioners also can help to add moisture. And so shampoos, or to not take it away. And so shampoos that are sulfate free often don't take out the moisture, and you can look for sulfate free shampoos. That's helpful.
So Stefani, earlier you mentioned that there were 2 types of hair loss that tend to affect Black women, and you mentioned the traction alopecia. And I think the other one is CCCA, which I actually have been diagnosed with. So last year, like the thinning that you were talking about, I started experiencing that sort of like in the crown area. And, but it was also sort of characterized by this sort of irritation and strong itching. And that's what sent me to the dermatologist. And just like you said, I went to one who specializes in African-American hair. She is an African-American woman. And so can you help our viewers like understand what that is, what CCCA is, and how is that different from traction alopecia?
Absolutely. CCCA is probably the most common hair disorder I'm seeing among Black women right now. And it is exactly what you described. So it's a gradual thinning of the hair right on the top of the head in the crown area, usually, although it can affect any part of the hair, I should say that. But most commonly, it's right at the top of the hair where it starts. And some women don't have any symptoms at all. Others will have a little bit of itching or a really intense itch or pain in their scalp. And what happens is that area of thinning just starts to expand outward over time. And then CCCA, which is, well, it stands for central centrifugal cicatricial alopecia, just in case anybody wants to know. But it is a form of scarring hair loss. So once it has progressed to a certain point, you lose the hair follicles that are there and you can't get them back. Okay. What happens, or what we believe happens, is that there's an inflammatory process that's destroying the hair follicles and causing them to scar. Okay, and that's why you see the thinning of the hair. So if you don't remember anything else I say, if you start to experience those kind of symptoms, or even just notice that you're thinning right at the top of the scalp, please go see someone as soon as you can, because the longer you wait, the less likely the treatment is going to help you grow your hair back, or even to maintain the hair that you have, to keep the hair that you have. So really go and see someone as soon as you can. I see a lot of women who they wait, or they talk with their stylist, and then they try to figure out, well, am I not eating this, or am I not doing that, or maybe I should try Caronique, or all of these different things, or their stylist just starts covering it up for them. And then by the time they get to the dermatologist, they've had permanent loss in that area of their scalp. And a lot of times the best that we can do is to keep what they have, but not to help to regrow. So as soon as you start to see any of those symptoms, please see someone for evaluation.
Yeah, and that is the key, getting in there, because I think I got to the dermatologist in the very beginning stages. Mm-hmm. And so the treatment was and is, because I'm still on the treatment, but it was successful in that space. And I've always had one little spot that's just always been there, but like you said, it's just started getting wider and wider, and mm-hmm. And so I think we caught it early enough where the follicles were not yet destroyed. Mm-hmm. So the treatments was able to regrow that hair. And so now the space is pretty much gone, except for that one little spot that was always there. So I say that to say that, again, the treatments they work, but we got to get there to get the treatment so that they can work, right?
Right.
And not ignore those signs and symptoms. Because I had a stylist too, and her first piece of advice was go see a dermatologist.
That's
and
excellent.
So yeah. And so, the stylist can only do so much when it comes to the treatment, like you said earlier. And so it's important to pay attention to those signs and recognize that what's normal and what's not normal for what you feel on your scalp.
Yes, yeah, absolutely. Listen to your body. The other thing is, so CCCA is a condition that we see almost entirely in Black women. You rarely see it in someone who's not Black. And so we believe there's a genetic component to it, but there's also an environmental component, which we think is related to hair care practices. And we haven't kind of nailed down one particular thing, but the other suggestion would be to make sure that, just like for preventing traction alopecia, you are not doing any styles that are causing tension or pain or discomfort to your scalp. So you have to be really careful about your weaves and your weaves, braids, even locks, even heavy locks, because that can just add to that inflammatory process and cause CCCA to worsen. Or we're not exactly how it all comes together, but we know that that's part of it. So just be careful with that.
Stevani, do you see a lot of issues with people that use the glue associated with the lace fronts? Like, is there a way to do that glue safely or not really?
So I don't know of a safe way to do the glue. I'm sure there is. I just don't know enough to comment on that. But I generally tell my patients, stay away from the glue. Don't do it. because I see it pull out so many hair in so many people. And so in general, I say don't do the glue. The sew-ins, they can do less damage, but again, only if you're braiding the hair in a not tight way, right? It all depends on technique and how your stylist is doing these styles. So we think about weaves, wigs, braids as being protective, but they're not protective if they're not done properly.
Were you gonna say
Yes,
something?
I just have one last question. So the four of us on here are all married to bald men. Now, we won't comment on whether that was by choice or that was some of that androgenetic alopecia. But what should they know about taking care of that scalp and their beards and, in their facial hair? What would you say to them about maintaining the health of that skin and hair?
Okay, yeah, sure. And add one more, because I'm married to a bald one too. So
I didn't know Jason had went bald.
Girl, yes.
Jason's in complete denial about that.
but yeah, so we all in the same
All in the
game.
same boat here.
So for men as well, they need to still wash their hair. Okay. They can use oils for their scalp or for the little hair that they have left. And one problem that I see commonly in Black men is hair bumps at the back of the scalp, and then also in the beard area. I would tell them to be really careful about how they're shaving their heads, being careful with their clippers, not so if they suffer from that issue, I guess I should say, if they have that issue, not getting too close will be helpful. And when they're shaving their beards, to shave in the direction that the hair is growing, not against the grain, but with the grain. There are treatments for that. So if they, every time they shave, they're ending up with these sore bumps, they should also seek help, because the dermatologist can help them and give them some treatments that are helpful. The other thing is not to dig into the skin to try to release the hairs, because oftentimes we do more damage and you end up with the dark spots. So I wouldn't recommend that. And if it's on the back of the scalp, there are definitely ways that we can get those bumps to go down. A lot of times we end up injecting them with the medication or giving them just creams and things that they can use that are really helpful. So they might have to make a trip to the doctor, even though they don't want to, but there's help.
What about those creams? Like Steven uses cream that smells like raw eggs. So instead of shaving, I think it's called a depilatory cream.
Oh yeah. Uh-huh.
Yeah. Is that okay?
Yeah, so for a lot of men, if they suffer from the hair bumps, the depilatories are better than shaving. The first thing is growing out a beard if they want to wear a beard, but if they don't and they want to shave or they have to shave for work, the depilatories are a nice option, because there are some people who may be sensitive to the chemicals that are in the depilatories, but for those who are not, it is a really great alternative.
I'm sensitive to it because it smells god awful. It's so sticky, but I'm glad to know that he's, using the good technique by using that cream. So, well, Stevani, this has been an education for all of us, our viewers included. We just want to thank you so much for being a part of the show on today. Anything else you want to say to our viewers before we go?
No, I've enjoyed talking with you, and if you have any questions, let me know. Also, a good resource I'll just mention is the Skin of Color Society. The Skin of Color Society is a group of dermatologists who focus on people of color, of many darker skin types. And we do have a lot of information online. And so if you go to that website, there are some patient education handouts, and it talks about a lot of the common topics or common diseases that we see in people of color. So that's a good resource.
Awesome.
That's great.
Yeah.
Fantastic. Well, thank you, Stevani, and thank you to all of our viewers that joined us on tonight and today. This concludes our episode of the Black Scientists Cooperative. We will see you next time. Take care.
Sure.
Bye-bye.
Deep flows like a breeze flowing through me, from my head to my feet. Your love runs smooth, ooh, it soothes, and you're making life right. I'm so glad that you're mine.